You can be doing everything right on the front end and answering the phone and having the patient walk in. But if the clinical aspect of that is not executed to the same caliber of what the phone is, then the case acceptance stops there.
This is Dental All Stars, where we bring you the best in dentistry on marketing, management, and training. Here's your host, Alex Nottingham.
Welcome to Dental All Stars, and we are doing another coaching playbook episode. We have Eric, our president of coaching, as always, on these calls, and we have Jenn, one of our great mastery coaches from Alaska. Hey, Jenn. One of the awesome things about Jenn, besides just being a great coach, is you still work part-time in an office. And gosh, the numbers that you're pulling in terms of a treatment presentation are phenomenal. So it's nice that you can bridge both the gap when it comes to coaching and treatment coordinating.
Absolutely. Honestly, I think that's what makes me a better coach.
Well, tell me about you. What got you into dentistry? How did you end up in dentistry and doing so well with treatment coordination? And then also, what led you to be a coach? And by the way, our topic today, we're talking about the emotional exam. So tell me about those two areas of your journey.
So I always knew that I wanted to be in the profession of helping people, whether it was through psychology or teaching. And I stumbled across the assisting program, which I did probably about 20 years ago. And when I moved back to Alaska, I was fortunate enough to come to a practice that Eric was actually coaching. What is that? 17 years ago. And he became my mentor.
Starting in 2004.
Yep. And when I saw Eric speak and coach, I thought, wow, I want to do that. That was invigorating as a teammate and an employee. And I thought, wow, that's amazing. And my mentor taught me that business is not about dentistry. It's a relationship-based business. So that truly touched me and it inspired me to want to do more. And here I am today.
And just to remind me, these numbers are enormous what you're doing. What was like $100,000 a month, some months? What are you doing over there?
Yeah.
In Alaska?
Yeah. In Alaska, yeah. And we still have teeth here. It's about 100.
You have teeth? You have people? That's amazing.
Alaska with teeth. Yeah, well, we make a joke that people around here have missing teeth and we don't care about it. So I'm basically a treatment coordinator is my position. I've done it all, but that's where my truly gifted talent is. And the way to do that is through what we call the emotional exam, which is SWOT.
Tell me, what is this?
So,
because I forgot. I think you and Eric told us about it before, but I totally forgot. What is this? I know in business school, SWOT, I've learned the strength, weaknesses, opportunities, threats, but you're using this in a case presentation format. Very interesting. Tell me.
Yes. And so it's the same thing. It's not the business side of it. It's getting to the emotional part of dentistry. And, with all the training with All Star Academy and answering the phone and doing everything right, it's so important to keep that experience throughout the entire appointment. You can be doing everything right on the front end and answering the phone and having the patient walk in. But if the clinical aspect of that is not executed to the same caliber of what the phone is, then the case acceptance stops there.
Jenn does a phenomenal job with taking what's been gathered on the phone call, that research through the great call process, replaying that and building a relationship with the patient that gives her a launch into the emotional exam. I don't think she likes it when I share this, Alex, but her practice does phenomenally well because of her. Obviously getting to coach her for almost 20 years. We've had our eye on her for a long time and her ability to deliver. And I always say my claim to fame for Coach Jenn is her collecting $104,000 in one day from 4 patients. So not only presents it, she collects it, she gets the patient scheduled. She does it all from the standpoint of what we teach. And the core of that, the heart of it, what I think works so well for Jenn is her ability to do this emotional exam so well that the patients are so connected, the trust is built so high that they're listening to her they're connected with her, and then she presents it in that same format. People buy with emotion, justify with logic. What's their reason for buying that? And so, yeah, Jen, tell us how you do that so well with your new patients.
I think the important part for me that I always try to remember is they walk in with a purpose. They're there for their own purpose. And in dentistry, we like to tell people what to do. We like to just have them come in. We're going to get a pano, we're going to get bite wings, and this is what we're going to do. We're very transactional. So, getting my mind out of that transaction and really listening to the person that's right in front of me and their purpose for the day. It's very important to be able to earn the right to ask the patients these questions. So you don't just bring them back and sit them down and say, all right, we're going to get some x-rays today. And why is it important for you to keep your teeth? That's not how it goes. And when you do that, it comes across fake. And that's what most of us do. We bring them back. We're like, this is what we're going to do today. And this is what you need. And we assume that because we're the professionals, we're going to tell them what they have to do today.
What I like about hearing from you, if you can just give me a quick background of what the SWOT stands for, and how in terms of the case acceptance, how you use it, and give me an example, because what's nice is you're actually doing it. I mean, we can talk theoretical, we can coach others on it, but it's nice to see someone who coaches but also is in the front lines doing it.
So the SWOT, the S would be the strengths, which would be asking a patient, what is it that you like about your smile? How it looks, how it functions. Tell me what it is that you like about it. And so you're getting the strength. Usually, what most patients do is they go right into the weakness, what they don't like. Oh, I don't like this chipped tooth, that this is what I don't like. And so you're gathering that information. And the O is the question that you ask. If you could have the functionality and the look that you've always desired, what would that look like for you? And before you get to the T's, which is the threat, you're going to ask the question, and why is that so important to you? Or what would having that make you feel like? And right there is the key to being able to find out with the patient why they're truly there and what is most important to them.
I think it would be fun if maybe we can do a role play. We can have Eric be the patient and you can be you, the treatment coordinator. So, Jen, set up a scenario of how this will work, and Eric will just do what he's programmed to do based on the scenario. But what would this look like? Maybe some from your experiences, we can see this play out.
Sure. All right, Eric, are you ready?
I'm ready, Jen. Hit me with it.
Eric, it's such a pleasure to
Yeah,
have
it's
you
great
here
to be
today.
here.
We treat our patients with the utmost quality of care. And in order for us to do that for you, I'd like to ask you a couple questions to get to know you better so that we can come up with a personalized care plan for you. Is that okay? Tell me about your smile. What is it that you like about your smile? The functionality, the look.
Mm, what I like about it, I mean, I have all my teeth, and other than my wisdom teeth, and there's no pain, and yeah, they function well. Yeah,
Okay. And is there anything that you would change with the aesthetic, with the look or the functionality?
I mean, I have a food trap in the bottom right. I have some sensitivity there sometimes. And then I went through braces and I stopped wearing my retainer. And so up in the front, I'm not crazy about how it looks in the front. It's not, doesn't bother me a ton, but I'm also not crazy about it as well. So I've had a couple cavities, and I had one of them that was like a metal filling. I had that replaced because I didn't like the way that looked. So I'm not sure about the other one. I can't really see it. So those are some things I can think of off the top of my head.
You did the strength already, the S,
Yep.
which was what he liked about his teeth, and he
Hmm.
seemed okay about him. And then the W, or the weakness, he just explained the food trap and the filling change. Okay, so we're SW.
Yep.
Yeah, following along.
Yep.
Continue.
What would having a healthy smile look like to you?
For me, I have a healthy smile. You know, um, I often wonder, is it as ideal as it should look sometimes? But it's just keeping it that way for me is I think the most important thing for me.
Okay. And how about that food trap area and
Yeah,
mm,
it's a bother. I mean, every single time I eat. So you tell me, you look at that and tell me what you think can be done. I'm not really sure why that's happening. It didn't happen until I had braces, and then after I had braces, that I had them as an adult, and that started happening. So you can take a look at it. And let me know what you think.
okay. And tell me why is that important to you? Why is the health of your mouth important to you and having that?
I mean, I I definitely don't wanna lose my teeth. I don't wanna lose a tooth. Some people go to school in their dreams, and they have this nightmare where they, like, didn't wear pants to school, but my nightmare is I lose a tooth, uh, break a tooth. That's just something that I don't wanna go through at all.
Mhm. And why do you think you have those nightmares?
I'm not sure. Maybe I'm grinding my teeth at that
But
time, but I will tell you this: my grandfather didn't have teeth, and as a young grandchild of his, he would every time I saw him, he would stick his tongue up in between his denture and the roof of his mouth, and he'd clack his fake teeth at me. And as a 5-year-old, 6-year-old, 7-year-old, that was terrifying. And so for me, I know I did not want to go down that path. That is top of my list as far as keeping my teeth goes. I do not want to experience that.
mhm, okay, I see. Well, thank you for sharing that with me, Eric. That's thank you. So that is the why,
So that
and then
was
I'm
well,
gonna
that was the O?
the O. Mhm.
Okay.
And he shared with me why it's so important to him. So I'm gonna go to the T now. So what's kept you away from having this done in the past, Eric?
Nobody's ever talked to me about it, I guess.
So for you, it was more of education, sitting down and taking the time of what can be done for the functionality of your teeth and knowing why you're having the food trap there.
Yeah, I've never had this conversation with anybody. Never really, give it this thought, but it are things that are in the back of my mind because I do think about it. I just never talked about it before.
Well, thank you for sharing that. I'm going to share this with the doctor and we will come up with a personalized care plan for you so that we can reach your dental goals.
Awesome, I appreciate that.
The threat would be the information that I'm gathering of why he didn't move forward in the past and what his future objections could possibly be.
The gold, the heart of all this is people buy for their reasons, not your reasons. So finding not only what I want, which is keeping my teeth, have them look nice, not having this food trap down here, but why? Well, if you really dig enough, you're going to find out that I don't want to lose my teeth like my grandfather did. So let's say we get into the exam and she finds, the doctor and her find gum disease or decay. She's going to relate that constantly what grandpa went through. This could be a reason why grandpa lost his teeth, gum disease, right? And just connecting all of that.
I'm the doctor. What would you tell me or in that case that you found?
Eric, if it's okay with you, I'm going to share with Dr. Nottingham what we have talked about so far. If I miss anything, feel free to chime in. Dr. Nottingham, Eric is
Okay.
here today. He shared with me that he's here today because he is wanting to maintain the health of his teeth. He likes the way they look. He likes the functionality. The one thing, if he could tweak anything, was after he had braces, the front tooth kind of turned a little bit, and he's got an area on the lower right where he's got food being kind of stuck, getting stuck there. He shared with me that in the past, nobody's really had sat down with him and giving him options of what to do to straighten out that one tooth and why the food's getting packed there. So, what he would like to do is learn about those options today. Eric, is there anything else that I missed that you want to share with the doctor? No. And the
No,
other thing
that sounds great.
that's usually what the patients say, and they leave it at that. Then I'll say, "Oh, and one more thing, Dr. Naham. The reason why this is so important to Eric is when he was young, his grandfather lost his teeth, and he would flick his denture on and play with it. So if Eric's number one goal for his health is to maintain the health of his teeth and keep his teeth.
So it sounded like to me what you did is you really did a wonderful fact finding mission. You got to know Eric, and then you replayed and paraphrased his whole story back to the dentist in front of him, which showed you were listening, trust, and everybody's on the same page. That's beautiful. And then that puts the patient in a very open state. They see that you can be trusted, you care about them, and there that helps obviously case acceptance tremendously.
Oh,
So
absolutely.
Jen,
Mhm.
thank you so much for going over the emotional exam. And I really enjoyed the role play to see it in action. I think our listeners really, really appreciate that. And I also want to put a link, I'll put a link in the show notes, allstardentalacademy.com/dental coaching, dental dash coaching. And that will be a link where they can see your bio. You're there, Eric, you're there as well, learn more about coaching. And what's great about coaching is it's, yes, you learn these skills in our online program as well with coaching, but then it's the application, it's a role playing, doing what we did here so that the team can replicate. Because if you're a great producer, which we know, and then we teach the team the skills you have, but there's one other step. It's the practice. It's the role play. It's that they're getting comfortable on the spot. It's one thing to understand it academically, but if you can apply it, if you can role play it, and I would even say this was really enlightening to me. I would work with the team on this, which you do. I know that, Jen. You have great reviews with the team, and then bring the doctor in to role play the same example. Have somebody play patient, somebody play treatment coordinator, and the doctor, and so that everybody's on the same page. And it's a beautiful performance. It's a performance, yes, but it's one that it's not fake. It's from the heart. But it shows the patient. It's always nice when you're looking to buy something as a buyer that the people you're buying from did their homework and you're their homework. They prepared themselves well and they know you. It's a lot easier to buy that. When they're just telling you what to do, then it's like they don't care. It's all about them. But people love to hear about themselves. So thank you, Jenn MANRIQUE. Thank you, Eric Vickery. And please remember to follow us on Apple Podcasts and Spotify. This way you'll get the episodes as they are released. And share with your friends. This is great material. And until next time, go out there and be an all-star.
We hope you enjoyed this episode of Dental All Stars. Visit us online at allstardentalacademy.com.